My name is Dr. Tyler Tolbert,
And I'm Dr. Soren Pappi,
and you're listening to the Fix Podcast.
your source for all things implant dentistry.
Hello, and welcome back to the Fix Podcast. So you may notice that we are missing someone today. So Dr. Pappi is off on his first vacation in like 2 or 3 years down in the DR with his beautiful girlfriend and spend some time down there. And I'm back here recording podcasts. But I'm actually having a really good time. And today I have a special guest with us, Dr. Drew Phillips. So he and I actually have some similar beginnings. So we both graduated from the Dental College of Georgia. So we're some down South Georgia boys that have come out to a different part of the country to do a whole bunch of full arch. And so Dr. Phillips here has an incredible body of work. If you're unfamiliar with his work, it's pretty impressive. I suggest you find him on Instagram. He is a fully remote anchorage capable full arch doctor, and he hasn't been out much longer than I have. What year did you graduate, Drew?
I graduated 2019.
Yeah, so not much further along than me at all, but so much further clinically. So I've been so impressed with everything you've been able to do, and I've been anxious to hear about your clinical progression and how you got into doing what you've been doing for some time, and what better way to do it than live on the show. So really appreciate you taking some time out, and I'm anxious to get it going.
Yeah, for sure.
Awesome. So for those that don't know you, could you just kind of give us some description of your background, your general story, how you got to where you are, just the overarching view?
Yeah, so it's funny. I'm actually from Georgia originally. I kind of grew up only knowing anything medical. My father was a radiologist, and I grew up wanting to be, some sort of surgeon. Originally it was an orthopedic surgeon, and I had the opportunity to shadow basically every surgery there is in the hospital, anything from like total hip replacements to just simple stuff. And the thing that they all had in common is that they told me if they were to do it again, they would be a dermatologist or a dentist.
Mm-hmm. I heard that a lot. Yeah.
And I was like, oh, okay. Well, dermatology sounds terrible. And, my father being a physician is like, dermatology is terrible. Don't do it. I mean, yeah it's good money.
You don't want to
and
be a pimple popper?
Yeah. I mean, it's one of those things where it's like, the diagnosis 99% of the time before you even walk into the room. So it's like, they make good money, but like, I want something more challenging and something,
Right.
I think that would be more fun. So started looking into dentistry and really enjoyed it. And my sister as well. My sister graduated dental school 2 years before me.
Okay.
So she's a pediatric dentist here in Boise as well. So I went to college in Florida and then ended up going to dental school, in Augusta. What a wonderful place Augusta is. One week a year.
Yeah,
it's
that's right.
like everyone's like, oh man, Augusta, that must be such a cool place. And I'm like, yeah, one week a year. It's really cool.
Try the other 51 weeks.
It's like the city spends like the 2 weeks before the Masters cleaning it up, making it like a really nice place. And then the day it's over, man, it's all done. Back to old Augusta.
And I never really spent much time during that period because I would always just like rent out my condo or whatever, and then I'd skip town. So I never even really saw it during that golden moment. I saw it for what it really was, but what, that's the crucible that we both went through, and here we are. So I'm appreciative of it.
It's funny. One of my classmates, his house was close to the National, and one year he just with dental school he just like hadn't cut his grass, and they came over and was like, "Hey man, can we cut your grass?"
That's great. You just hold it out.
Let them take care of it. They have a vision they want people to think, but it's great. I go back every year for the Masters. It's a good time. So yeah, so awesome. I went to dental school, Dental College Georgia, Medical College Georgia, Georgia Regents, whatever you want to call it,
depending on who you ask. Yeah.
Dental school was dental school. It was funny. I'd never made straight A's until I went to dental school.
Oh, really?
Yeah, I was never a great student. I think in college, I had a great time in college, but I think my science GPA was like a 3.2 and standard GPA was like maybe a 3.6, which compared to like my dental school classmates was like not anywhere near theirs.
Yeah.
But but I killed the DAT. It was like I studied for that thing like it was a job. It was like 6 days a week, 10-hour days.
Great.
It was funny, like 2 weeks before the DAT, like I realized like how to take the test. Like everything finally clicked, and I was like, oh wow, I don't really need to know this information. I just need to know what the wrong answers are going to be, and then I just
Yeah, it's
pick the
just
right
right.
answers.
Yeah.
Like it's just like a game, and it's fine. I've actually
Yeah.
helped a lot of people with the DAT since, and yeah, so I did really well in the DAT,
Nice.
and yeah, so I got into dental school, which it was like my dad was like, hey, Drew, like you should look at some other options. Um, just kind of like, I'd never, it was one of those things, it's like, but, I got really lucky and got into dental school and, um, made the first, I think it was like the first test, like a biochem test, made it like a 93 on that. And I was like, oh shit, like
Hey,
maybe I can do this
yeah.
thing. Cause like, I'll admit, like
Nice.
I went to dental school, like my sister, she'd been a straight A her whole life and made 1B her first semester in dental school. So it's like, well, shoot, if
Oh
she
man,
didn't do this,
reality just came crashing down on her.
yeah,
Yeah.
it's like there's no way I'm gonna make straight A's. I was like, I go
uh,
like through dental school, like when I get in, like my whole mentality is like C's get degrees, like let's just get out of dental
mhm.
school. Um,
Yeah, totally.
but yeah, I ended up doing really well, and I worked my ass off in dental school, and
Mhm.
so I ended up graduating. I was valedictorian of my class.
Mhm.
Um, so everyone was like, so I ended up going to a GPR after that. I went to the VA hospital in
Mhm.
Salt Lake City.
Okay.
I had I ranked that number one. There's some other great
Yeah.
programs I was looking at.
What attracted you to that one?
So, there's a few things. So the other one I was really interested in was the Foundry in
Yeah.
Alabama.
Mhm.
The VA in San Antonio had a really good reputation. A
Yep.
few others had really good reputations. The one thing I really liked about Salt Lake City was number one was location. I grew up,
Yeah.
we grew up skiing. We were not like a beach family; we were a ski family. So we were always
Mhm.
out in Utah skiing, and that was
Nice.
a big drive for me. Um,
Mhm.
Kind of, I guess, jumping right into like my residency after dental school was the thing I loved about the VA in general was the fact that patients didn't have to pay for treatment. So it's good and bad, right? Like I never learned how to sell treatment and how to sell my treatment plans, but
Sure.
I learned how to basically do everything. And that the VA in Salt Lake City specifically, we had a different specialist pretty much every day of the week. So, it was like
Mhm.
Monday we had endo, like every Monday afternoon we were doing molar endo. Every Monday morning we were
Oh
doing,
wow.
we had an oral surgeon. Um, we had a day with Thursday was perio, Thursday was pros. Some Tuesdays I think we had an oral surgeon. Then on top of that we had, a handful of really good GP attending. So, we
Mhm.
really got our hands in every sort of specialty and learning from those specialists as well as running from the GPs there, which were doing a lot of the same thing. So
Mhm.
I'm really thankful for my GPR. I think it gave me a little bit of a head start. Um, was cut short with COVID though. COVID hit, I think it was like March of that year.
Mhm.
And I remember I was one of the first 100 people in Utah to get COVID. I was like, there's the
Oh, no
state's,
way.
I was like, the state's like specimen. They were calling me like multiple times a day. And I'm like, guys,
You
like, I'm
just
fine.
you gotta lead the pack. That's your whole personality. You
Yeah. It's just like,
gotta
I'm fine, guys. Like,
patient
it's not a big
zero.
deal. I'm just chilling in my house, Ubering, getting Uber
Yeah.
Eats. And,
Wild.
but, I think the one thing that my GPR probably taught me the most was how to do dentures. I mean, we did a ton
Mhm.
of
Yeah. It's
dentures
huge.
in my GPR. Um, you know, we were doing full mouth extractions. We didn't do any full arch in my GPR. Our standard of care was 2 implants, mandible for
Sure.
snap denture, complete upper denture.
Mhm.
But it taught me a lot because dentures, I think, are like the basis for everything.
Everything.
And I see so many people, I get hit up on Instagram pretty frequently with people being like, "Hey man, like how do I learn how to do this?" and things like that. And I'm always like, "Go learn dentures, go work at Affordable Dentures or something like that and just like
Yeah.
do
Even just a
dentures."
year. Yeah. Yeah.
Because I mean, you could tell me like, hey man, I want to do veneers. I want to be like Dr. Appa. I'm like, okay, go learn dentures, because it all starts with,
Yeah.
where you put in your incisal edge and the bite. Like
Mhm.
dentures is like the basis. And man, we hated dentures in dental school. Like everyone hated them.
Oh, yeah. Yeah.
Um, Freaking, I mean, Metzler still, like you know what's funny about Metzler actually, and I hope he actually listens to this, or someone should send it to him, was he worked at the VA GPR
Oh,
before
no way.
before he was at Georgia.
I didn't know that.
Yeah, I remember seeing patients and I'd
Yeah.
like scroll back, look at their chart and be like, what's done? It's like Kurt Metzler. I was like,
Yeah.
oh shit, what's up, man?
He was the man. Yeah, I still, it's funny in retrospect. You look back on those guys and you're like, you know what? You made some core memories for me that, some of it's bittersweet, but you
Yeah,
know what? It's a memory.
seriously.
I could still hear Thunderstruck for every RPD practical that I did.
Yeah, I
It's
can't
in
say I
there.
did any
Yeah.
parcels after dental school, but yeah, I mean, so
Yeah.
learning dentures, I think, is just an
Yeah.
invaluable thing, and also the other thing it teaches you, which I think is invaluable, is like patient management.
Totally.
How do you
Yeah.
speak to patients? How do you set expectations for these type of patients?
Yeah.
Um, so yeah, so my GPR, I did about 100 implants, I think, a few
Oh, that's
immediates.
fantastic. Yeah.
Um,
Those are mostly in the context of an overdenture.
We did quite a bit of single implants.
Okay. Okay.
Um, we did, I did a lot of sinus grafting, really not much like direct sinus grafting, a lot of lateral sinus grafts. I still
Hmm.
remember my first one. Uh, my attending Lane Brown, he did one, the person needed bilateral and he did one
Hmm.
side and I was meant to do the other side. And like right when I was starting, we had a whole bunch of people show up that were like interviewing or visiting for the GPR. And I'm sitting there with like four people over my shoulder. Lane, Dr.
Perfect.
Brown, he had already left the room. He like went to go do something else. He's like, you got it, man. And I'm like trying to do this thing. And I got all these people over my shoulder and they're like, dude, I have no idea what I'm doing.
Hmm.
And they were like, it turned out good, but so we did a lot of
Yeah.
that. The other thing that we did was anything we did on the mandible, like you flap down to the mental nerve. So I see a lot of people learning full arch now, and they're like, everybody wants to make these like little baby flaps, and I'm like, you
Oh,
can't
yeah.
see anything. You don't
Right.
know what you're doing. I mean, I flap, and every now and then the drill comes out the buccal plate, or an implant, and I'm like, wow, if I didn't have it flapped, I would have never have seen
At
that.
least you knew it. Yeah,
Um,
totally.
so, I was never scared to make big flaps because we were forced to. I mean, we were.
Hmm. That's great.
Um, so yeah, so that was my GPR experience. It was really invaluable for me to work with all these specialists, and
Hmm.
um, do a lot of dentures. Even though I didn't like it while I was doing it, I look back on it and I'm like, man, I wish I would have done more of these. Or
Yeah,
um,
it's invaluable. Yeah. Yeah. So, like, at that time when you were going through the GPR, was your mentality that you were going to be like an omni-capable GP, or was there like kind of what was the end in mind?
So, out of dental school, I didn't know what I wanted to do. And everyone was
Okay.
like, oh, why aren't you going to ortho, or why aren't you going to oral surgery? And, um, ortho was out from day one. To me, that just sounds not fun and, you know,
Yeah. I hear
good for the orthodontist, but it's
you.
just not for me.
Yeah.
So, GPR for me was just like that next step. Out of dental school, I thought that I might like endo. And after like two molar endos, I was like, I never want to do this ever again. Um,
Yeah. I was under no illusions
yeah,
when I came
my
out.
my first root canal out of residency was like number 19, and
Mhm.
broke first file ever broke, first patient out of residency. I was like, wow, and I think that was the
Perfect.
last root canal I ever did.
That's great. That's great.
Um,
Yeah.
but yeah, man. So it was, yeah, I loved it.
Yeah, cool. So you're coming out of GPR, and you have the sobering reality of breaking off a file in a number 19, and you got all these skills with like dentures and surgery and implants. So what was the next step? How did you kind of transition from there? What was the direction that got you kind of in more in the aim of surgery?
So my GPR kind of got cut short. There was about 3 to 4 months
Right, with
where,
COVID. Yeah,
and
sure.
so there were some things that I wanted to do and learn before I kind of like dove right into whatever I, ended up wanting to do, which I really still didn't know. I still had this idea in my head that I really liked cosmetic dentistry, and that was not something that I got to do at at my GPR, because it's the VA and we do
Yeah, it
functional.
wasn't so elective.
Yeah, we
Yeah,
do
sure.
functional dentistry, not aesthetic dentistry.
Right.
And so I went to go work at an office in Salt Lake City, where I was doing a lot of sedation dentistry, and
Oh, cool.
I was doing, probably 1 to 2 sedations a day, just
Great.
whether it was
Yeah.
fillings, crowns, implants, things like that. And I was there about, I think, 5 or 6 months before I left.
Okay.
And I started doing some full arch there. I probably did maybe 20 arches while I was there. Most
Yeah,
of them
that's
are
great.
all under my own sedation too, which is, I would never do that again.
And were you doing your own conversions as well?
So there was like a quote unquote in-house lab there. So they were
Okay.
kind of doing the conversion. I mean, we were helping, but for the most
Okay.
part, they were doing the conversion, and then we were restoring. So I think, like, if I,
Okay.
going back to, I think, they wanted me to do something like 20, like, take like 20 patients to finals or something like that before I did my own surgery, which is for sure the right thing to do, is to learn the prosthetic aspect of it before you start, throwing some
Yeah, I think
implants
that's
in.
fair. Sure.
Um, yeah, I remember my first case still. It was a double arch. The owner of the office was supposed to come there and, like, basically hold my hand through it. And 20 minutes before, I called him and I was like, "Yo, man, where you at?" And he's like,
He's like, you
"Oh,"
got it, bud.
he's like, "I'm not going to make it." And I was like,
And then 4 people came into the clinic to watch you do it, right? This is
"Yeah."
just what happens.
Thankfully, they had assistants there that had done enough of them, like they could probably do it
Good.
themselves. But
Yeah,
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 my first double
yeah.
arch took me pretty much exactly 4 hours.
Mhm.
Still remember
It's
it,
actually
and
not bad.
I
It's
was,
not bad at all.
yeah, I was super proud of myself.
Yeah,
And I think it healed well. I don't really know.
yeah.
Um, yeah, so I was there, and then
Cool.
I wanted to get out of there pretty quickly, and was just looking at some different options. And that's kind of when I was like, okay, do I want to go somewhere where there's like a lot of more of like aesthetic dentistry? So I was looking at an office and working at an office in Park City, or do I just want to
Mhm.
go completely something different? Because this was really my first. This office I was working at in Salt Lake City was really my first, like, um, experience to full arch, and I liked it.
Right.
What they were paying me to do it was not worth my time. Like, I could have just been prepping crowns and I would have made more money, but I liked it. I wanted to
Sure.
kind of see where it went. The office I was looking at in Park City just really kind of didn't work out.
Okay.
So I went to California and was working at an office there that had another in-house lab that was doing a lot of, um, like, kind of a lot of digital workflow stuff. And
Oh, cool. Okay.
so I was
So
there.
this would was this like 2020,
This
2021
was like
or
20. See, graduated 2019. So this would have been like, I think it was like December. I started like December of 2021.
okay.
20, yeah, 2021. Um,
Okay.
and I did quite a few surgeries there. I did a ton of sedation, but the aspect of them having an in-house lab was huge for me. And becoming friends with the lab tech there is a guy
Huge.
I'm still friends with. He's actually out on his own. It's AOX Designs. Joseph Rodriguez, he's the man. Him and I are still buddies. We still, talk about cases together. Him and I created some protocols together. Um, and so just learning the digital workflow there was huge. And that's
Yeah.
really
Is
when
that with
my,
Gus Khalil? Is that
no, I
the
was in
same operation or?
AOX. It's, is it, what is his name? Joseph. No, it's not with Gus. That's actually where I met Gus, though.
Oh, okay. Okay. Yeah, I
Dude, all
see their
these
website.
people, what is his name? Joseph Rodriguez.
Okay. Okay.
Whatever.
Cool.
But yeah, he was the man. And that's where kind of like my CE journey started, and that's where I became addicted
Yeah.
to CE.
Nice.
And so I took a lot of CE courses that year. And that
Okay.
was like my first kind of remote anchorage CE course as well.
Nice, nice. So you were actually doing the fixed arches prior to really taking the CE courses. It was more just, experience in residency and then whatever was happening in that first place that you went to that kind of,
Yeah, so
gave
it
you
was kind
something
of
to
like
know
a
how to do
see
it.
one, do one, teach one sort of thing,
Got it.
right? Like
Got it.
I
Yeah.
I watched a bunch, I restored a bunch,
Hmm.
and I had the basics, right? Like I was fine laying a flap, which again is something that like conceptually seems really easy to do, but
Yeah.
you watch people that are new at it, or I go and like mentor people, and I'm like, man, that flap's got to be way bigger. I mean, like,
Yeah.
look
And
at what
it's
we're
split
doing. Like,
thickness and you can't see anything. There's blood everywhere.
yeah, it's
Periosteum
so,
all over the place. Yeah.
the basics. I had the basics of pretty much everything. I was comfortable around the sinus. I was comfortable around the nerve,
Great.
and so you just kind of have to put it all together. And
Hmm.
so yeah, so that's where I started my CE journey.
Cool.
And that was, I guess, my first CE like remote anchorage as well.
Wow. Wow. Yeah. So you kind of like were already kind of going straight to some of the more advanced techniques, like right off the bat with your CE. Yeah, that's cool.
Yeah, yeah, it was. After that, I guess maybe I took some steps backwards, but
Hmm.
remote anchors is not something I ever wanted to do. And the first course I took was a live patient course with Vishy Broman in his
Nice.
office in Arizona. And I remember
Yeah.
I had already become friends with him, and he was doing a course, and I was like, man, do I really need to learn this? Like, this is so out of my league. There's no
Yeah.
and he's like, man, you're young. You're gonna be, you're gonna see your own cases fail. I'm like, that's a
Right. Right.
scary
Yeah.
thing to think about. He's like, you should at least learn how to do it, whether you do it or not. Um,
Hmm. Hmm.
and I probably took that course too early, and I don't think I did any zygos. I probably did a handful of pterygoids. Didn't
Hmm.
do any zygos for about a year
Hmm.
until,
Hmm.
yeah, I was probably like 8 months after that course was my first zygo case,
Okay. Yeah.
and
That's a really big gap
yeah, and
from the time you learn to the time you implement. Yeah.
I did two in one day. It was a husband
Oh,
wife.
nice.
They were,
Oh, great.
it was,
Yeah. Did you know that they were going to be Zygos before you
I
started it,
did.
or
So
was it kind of
there's,
like a necessity? Okay.
yeah, so a little story with that. So my parents were still living in Georgia, and we'd had
Mhm.
this, the lady that cleaned our house, she'd been, she took care of our dogs. I mean, she'd been there when I was a small child. And
Cool.
I don't think anyone in my family ever realized they had like teeth problems. And I
Oh,
guess they
okay.
like saw what I was doing and Instagram or whatever, and went to my parents and was like, hey, like, we went to Clear Choice, and we got
Yeah.
these, yeah, it was like back then Clear Choice was charging probably like 60,000 plus
60,
dollars,
70. Yeah.
something
Sure.
crazy like
Yeah.
that. And I was like, well, like, go get a CT. Clear Choice wasn't going to share the CT. I was like, go get a CT somewhere and send it to me. And I immediately saw it, and I was like, Clear Choice said they could do standard all on four in this. There's no way. Like, both of you
Oh,
guys are
man.
Zygos, like
Hmm.
100%.
Hmm.
And I was like, well, I took a Zygo course. They're nice
Some
people.
time ago.
Yeah, these people are nice.
Yeah. Cool.
Like they've helped us. Like, so I did them for free, and we did them both in the same day.
It's
Um,
amazing.
and we did them at a friend's office in Oregon.
Okay.
Um, and from what I know, they're still good. I mean, they see my friend's office in Atlanta for cleanings now, and um,
Nice.
yeah. So that was my first Zygo
Yeah.
patient, was husband and wife.
Wow. That's awesome. So were um, uh, like, was it like a quad zygo, or are you doing like a single on one side, or
Yeah, so they were
what kind of
both
thing was it?
just posterior zygos, and look, I didn't even do
Mhm.
pterygoids on that case, because I mean that took me so freaking long, and
Yeah.
I was just like, so they, I've got posterior zygos on both, just two implants on the anterior for both of them. Both of them got four implants
Sure.
on the lower. One of these
Mhm.
days, they'll probably come visit me in Idaho, or in Oregon, or wherever I'm working somewhere, and I might go and add some pterygoids to them
Yeah.
because I want them to last for the rest of their life.
Mhm. Yeah,
Um,
ideally. Mhm.
but I haven't even looked at like the post-op CBTs, CBCTs. I'm sure the zygos are right in the middle of the bone,
Uh-huh.
right where they shouldn't
Right
be.
where you wanted them.
But
You split the field goal. That's great.
yeah, got to start somewhere, I guess.
Yeah, no, of course. Yeah, no, I mean, props to you for just kind of going in head first with that. I mean, a lot of people will take, 3 or 4 courses. They want to do a few cadaver courses, some live surgery, and then still want to do some over the shoulder, which there's merit to that, of course. But at the same time, I've noticed that a lot of the people that end up teaching these things, they can kind of be a little bit of cowboys, if you will. Maybe that's kind of a derogative term, but people that are willing to, feel confident in their abilities as soon as they, understand the full scope of it and understand that you're not really going to know how to do it until you do it. And I think that kind of service for a patient that otherwise wouldn't really be able to get something that would be a standard of care. I mean, if
Right.
there's a Zygo patient, why would they get, standard all-in-4? So, that was really cool. And so, after that, did that kind of, make you feel like, okay, I want to do a lot more of these cases, or how did you feel about it?
No.
Really?
I still like every time I see a Zygo case, I'm not like, oh man, I can't wait through this. I'm like, oh, really? Like, gotta do this
That's a good
today.
attitude, actually. Yeah, that's how it should be.
I mean, like
Yeah.
I can do them and I will do them, but it's not something that I like go strive to do and like really enjoy because it's exhausting. It's high risk.
Yeah.
I mean, it's high risk for anyone,
Hmm.
whether it's GP, perio, oral surgeon.
Yeah.
It doesn't really matter who's doing it.
Yeah,
Um,
you bet.
and thankfully, I've not had any Zygos fail. I haven't had
Hmm.
any huge issues from Zygo patients. I mean, honestly, my worst complication on a patient I've had is on a lower arch where the guy had the only teeth I had to take out was both canines. The only thing I had left, and that was like the worst Like it was just like a total massive infection,
Became a
just
mess. Yep, I've
hospitalized.
had that.
Like it was just
Hmm.
like a total
Hmm.
disaster. That I'm like, man, what could I have done differently? And I feel like I did everything
Yeah.
right. And he's got Zygos on the upper. I was like, really? Like it was I
And
think
those
it
want to
was
behave. Yeah.
2 years ago. It was the hardest Zygo case I ever did. Like
Hmm.
I drilled once, couldn't get torque. Drilled again, placed, couldn't get torque. Third time on this on like it was I can't remember what left or right side. It was like finally got torque. I'm like, man, this is the hardest Zygo case I've ever done, and I get a
Yeah.
complication on the lower.
Yeah, the irony. It's always the ones you don't see coming.
Yeah.
I've definitely found that the ones that I worry about tend to work out, and then the ones I wasn't worried about, just totally disregarded. Like those are the sneaky ones. They
Oh
get you.
yeah. The cases where you load it, it's like 100 Newton centimeters composite torque value, and it's like
Mhm.
everyone just go home and say your prayers, and
Yeah.
they heal amazing,
Yeah, no problem.
no problem whatsoever.
Yeah, yeah. No, I totally get that. So okay, so you placed your first Zygos about 8 months after that first course. Still not feeling entirely psyched about them. What kind of made you want to go a little bit further down the road of doing more fixed full arch and atrophic cases?
So this is when I started traveling to Oregon a lot. So I'd moved to
Hmm.
Boise at that point. I was working at an office here covering for a friend's maternity leave.
Okay,
Was doing that, was traveling to a couple of different offices in Oregon. And, we didn't stock Zygos and we started just getting some cases. And um, I was like, well, I'm kind of forced to do these now.
hmm,
Um, so I just started doing them, and I hadn't taken any other course yet. I remember I went. This was years ago now. I went to a transnasal course in Boston. It was just like a 1 day course. It was like David Zelig and Simon O was
Oh,
teaching it,
sweet. Yeah.
and
Oh, awesome. Okay.
it was it was a transnasal course. They talked a little bit about Zygos, but it was my first time meeting, like David Zelig and Simon
Hmm.
O. A
Yeah.
lot of the other guys I'd already met before, just through different courses or whatever. And I can't remember if Juan Gonzalez was there or not. But anyway, like again, like that course, like a few weeks later, I did a transnasal.
Nice.
That's been, I think, December was 2 years. Still have not seen
Hmm.
that patient for post op, but you know,
Well, I mean, it's fair to assume that things have worked out.
I think, yeah, as far as I know, they look great. But
Great.
so, I'd probably done, I don't know, 10 or so Zygo cases, very few quads, maybe a
Hmm.
couple quads. I mean, even still, like I've only done a couple quads. And so then I loaded up a case. I loaded up 3 Zygo cases one day, and I had Juan come do those cases with me in Oregon at the office I was at
Great.
there. So
Yeah.
Juan came and we did three upper arches in one day. Um, I think couple transnasal,
Mm-hmm.
couple Zygo, and it was great. I mean, it was, anytime you do something with any other doctor, like they're learning from you, you're learning from them. I was learning some
It's a
Zygo
cool
stuff from
thing.
him. I was showing him how I was doing my pterygoids because I was placing my pterygoids with just standard neodymium implants and had like, upper 90 success rate of every time I placed
Mm-hmm.
it. And, I wasn't using the Norris that, arguably was a better designed pterygoid implant, but I was having great success with just the neodymium like 3.75 by 18 helix
Mm-hmm. Mm-hmm.
and had
Yeah,
great
that's most
success with
common
it.
for me. Yeah.
And,
Yeah.
so I showed him kind of like what I was doing with that. I was using some osteotomes from Salvin. I was using some osteotomes from Norris, just kind of figuring out what worked for me. And, so it was cool just kind of collaborating with him on that and learning, each of us learning from each other. And,
So are you kind of like are you a drill osteotome hybrid type of guy? Is it, I mean, how do
man,
you like to do it?
I keep changing my ways of things.
Yeah.
So I love the Norris, the 2.0 sharp osteotome, which
Uh-huh.
I think the SIN one is almost identical to that now.
Yeah, yeah.
You can also
Yeah.
get it from like GDT for like $90 as well. And
Mhm.
so I at least just try to push with that till I can
Mhm.
feel something hard. Sometimes it's hard already. And, when I have that, I'm like, great, like almost doesn't matter what I do now. Like we're going to get
Yeah, you're good to
torque.
go. Mhm.
So I'll push with that until I feel something hard. And then I will just take like a standard spade drill
Mhm.
and go really slow and just feel until I perforate the plate. And if something doesn't feel right at that point, I can kind of redirect.
Redirect, right. Okay.
And then I have I believe it's 2.7 millimeter osteotome from Salvin that I got.
Mhm.
My friend Shivane Gupta is an oral surgeon in Atlanta.
Mhm.
Told me about that,
Yeah.
so I bought it back now, and so I
Mhm.
got that. And basically with that, if I can get that down to like 12 to 14 millimeters, like I go straight to placing the implant. If it
Great.
won't
Okay.
go in, then I'll pick up a 3.5 drill and go a little bit more. But
Sure.
what's awesome about that neodymium helix is you open up a cortical plate with the 2 millimeter drill, like you can almost
It'll get in
guarantee
there.
yourself that it's going to grab and go in there.
Yeah. It'll bite.
Um,
Yeah.
every now and then it would, an implant would hit it and it would spin, and pretty simple, just pick up the 3.5 drill and just,
Mhm.
I leave it on like the 40 Newton centimeter or 40, RPM speed and just barely open it
Mhm.
where you can kind of feel every turn it
Mhm.
just cutting just to open it up
Mhm.
enough. And,
I see.
um, and yeah, I mean, as long as I'm in the right spot, like my success rate is really high with my pterygoids.
Great. Yeah. Fantastic. Okay. Awesome. So that's your pterygoid, general routine there. So anything special would you say about your Zygo technique? I mean, would you say that's kind of like you know, I guess the way I should put it is, what kind of school of thought do you generally have in terms of your approach to Zygos, your
Yeah.
surgical approach with it?
So I have kind of like, I guess jumping off of CE, we can go back to CE if you want some other ones, but like,
Sure. Yeah, please.
my
Yeah.
my general approach, like I guess like kind of in my head, like my algorithm of like how I'm gonna approach each case, kind of like jumping
Hmm.
into like Patsy protocol, if you will.
Hmm.
So
Yeah.
for me, it all comes down to like where the sinuses are, right? And
Of course.
so that like where the sinuses are does it dictates like where my where my pterygoid implant starts. It dictates am I going to do a zygo. It dictates like
Hmm.
how my front four implants are going to be. So my train of thought is if I can get first of all, we don't want cantilevers if at all possible, right? So if I can get an implant at first premolar
Hmm.
and a pterygoid, I don't need a zygo. I feel like that spread is
Agreed.
fine.
Yeah. Yeah.
um, if I can get one at second premolar, great. And you can argue that on those cases, a one tooth cantilever for a molar is okay. I mean, we don't like cantilevers. However, ClearChoice has been doing that for forever.
Oh, that's the vast majority of cases that are in the mouth right now. Yeah.
And I have pterygoids under my belt, so yeah, I do them for most cases now. But look at what ClearChoice has done. I mean, they've done more than anyone else, and like their standard of care is just four implants, giving them a one tooth cantilever, and the people I know that have been there for a long time say they have great success with that.
Of
Um,
course.
so yeah, so my kind of algorithm is like if I can get like first premolar and a pterygoid, I don't need a zygo. If I can get
Okay.
first premolar and I don't get a pterygoid, I need a zygo. Um,
Hmm.
anterior is whatever. There are some cases now where it's like I've done things, where I would need a quad, and I've done, whether it's like transnasal implants. I have one case, again, all these cool cases I've done, people refuse to come back for post-ops. So I have a case where I had, I had like, I think like 6 millimeters, maybe it was like 5, like, under the nose. And I did pterygoids, 2 like first molar zygos. And then I placed 3 helix short right in the anterior. And it was all cortical
Oh,
bone.
okay.
So it wasn't like your standard. It's
Yeah.
cortical bone. I'm like, this bone's not going to. I talked to Dr. Molinari about it, and he's like, yeah, that's a great idea. So I placed, 2 like in about the lateral spot and 1 in the nasal palatine. Just those that was my first helix short implants I placed, and got great torque. It was all cortical bone. Again, I probably did that. I was like right after the helix short came out. Again, still haven't seen that patient back. It's like all the cool stuff. I don't see anything
Yeah,
back.
that's brilliant, man. Awesome.
But yeah, when it comes to Zygos, again, it's like it's just the flap and being able to see everything. Like, what's the difference? And doing a half-ass flap or just being able to see everything. The one thing when it came to my flap that I learned from. So I took a Alex Savoni's course in Brazil with Dan Rosen and Dennis Smiler. It was funny. I was never planning on taking that course, and I had a buddy that periodontist was going to go, and I was like, yeah, man, I'll go with you. And I think he had a family emergency, ended up not being able to go. And so I went. I had a great time.
Nice.
And one thing Alex Savoni is like, he was always getting me to flap like more like posterior on the arch, which like really opens it up a lot more than just trying to like only where the implant goes. And so, it's, again, like bigger flaps. I don't really use any of like the special Zygo retractors. I use a Minnesota. I have a pretty cool Minnesota. I don't know the name of it. It's a Minnesota with more of a handle. There's I think they make one that's like an Ergo Minnesota. It's not that. It's a little different.
I've seen this. Yeah, I saw it at Clark Damon's course, I think.
It's just
I
a
don't know what the name of
longer.
it
It's
is.
just a longer Minnesota, basically, and I love
Yeah.
that thing.
Okay.
I have like another instrument. Salvin makes one. I think they call it like the Zaga 3. I think Nestor posted about it today. I got one from like H&H Instruments. Just basically like the shape of like a Molt 9, but it's just like 3 times the size. And for me, it's really good for just blunt dissection.
Just a spoon.
Yeah, it's just like a big spoon. And
yeah.
So, just different things. And, the Brazil course was great. Brazil is my favorite place I think I've ever been. I love Brazil.
Yeah, it's great.
Love everything about it. I've been back. I think like I've been back. I went back this year for another course too.